Hey everybody, it's Dr. Levitt here, and I'm at the office where just yesterday I saw a patient whose case I want to share with you now, and I want to use his story to illustrate a point and to raise a question that is rarely asked in conventional medical doctor visits. So here's the story. This was a young man. He was about 36 years old, and he came to me with widespread complaints. He had complaints in his gastrointestinal system, with his respiratory tract, his muscles and joints and bones. This guy had a lot of different problems. And one of the things that came out during his history was that he had been on Nexium, a proton pump inhibitor for acid reflux, for over 18 years. He had initially had this heartburn problem nearly 20 years ago. He went to a doctor. The doctor prescribed this medication, and the medication worked like a charm. His heartburn symptoms went away, and he's basically been on this medication ever since. Now, when he came to see me, I asked him a number of questions, and it became increasingly clear to me that I was concerned that perhaps some of his current problems were related to adverse effects or side effects of the long-term use of this particular medication. We're not going to get into that story in detail now, but those medications can be associated with all sorts of problems if they're taken for too long. Now, in this case, he had been on these medications for nearly 20 years. So what was the question that this young man should have asked his doctor way back in the day when he was about 18 years old? He should have asked, "So doc, what do we do if it works?" This is a really important question that is rarely asked. Now, this can apply to proton pump inhibitors like acid reflux drugs, or blood pressure or cholesterol, or any other type of medication or procedure. What do we do if it works? You want to develop a plan or an action plan if you're going to go on a medication that doesn't just involve being on the medication for the rest of your life, especially if that medication has not been studied for long-term use, like it had in this case. So be advised, when you have a medical problem and it's treated with a pharmaceutical treatment, it's really important to ask your doctor and do your own research about what you're going to do if that medication or if that treatment works. Do you intend to be on this for a week, for a month, for a year, for 10 years, for the rest of your life? And are there any alternatives to the long-term use of a particular medication? Make sure the next time you get a prescription for a drug, any drug, ask the doctor, what do we do if it works? Take good care.